everyone, and welcome to Women's Health Tech Wednesdays. My name is Nina Joshi, and today we will be bringing on a very special guest, May Yamada-Lifton, who is the COO of Maypro. As you know, here at Women's Health Tech Wednesdays, we love questions. So if you have any for May during the conversation, please feel free to use the Q&A feature at the bottom of your screen, and I will make sure that we get to it. And so with that, we'd like to formally bring on our guest, May. Thank you so much for being here today.
Hi, how are you? Good to see you, Nina.
You too. Thanks so much for having us on. It was really excited to kind of kick things off. And of course, this being Women's Health Tech Wednesdays, we have to start by asking you, what does women's health tech mean to you?
Well, it means two things. I think the first thing is that female leaders create health and wellness solutions that really make the mark, change our quality of life and bring our vision to it. I think the second thing is that ecosystem, that community where we can help each other. I've worked in tech, I've worked in VC, not a lot of ladies at the top for sure. So those are the two things I think HITLAB's incredible at growing.
I love that. I love that like community-centric approach. I think that it really is important to not only, network, but to bring people up with you as well. That's incredible.
Yeah.
And would love to learn a little bit more about your background. So if you could tell us a little bit about yourself and your journey into the healthcare space, that would be amazing.
Yeah, listen, it's a long journey, but it all starts with my grandma.
Oh,
my grandmother had a bit of a difficult life. She was in Japan. Her husband died from tuberculosis, and she raised 4 kids by herself, single mom. And she ran like a boarding house, and she said, if you're healthy, you're going to be fine. And, it's a mantra. So health is wealth. Health will get you through anything. So that's just been carried down to my family. Now, I think I also had this passion for science growing up. So I was lucky to be exposed to doing like science research in high school back in the day when your parents didn't force you to do that in middle school, So I was actually able to do this prestigious project at Bronx High School Science where we do a science project. So I did extract DNA from ancient bone using technology that was really new then called PCR, and trace the lineage of monkeys to see, are they related, lemurs, are they related to humans? But I was just so fascinated by genetics that helped me get to MIT. And, I love the business of health. So I was like, I need a skill. The lab experiences wasn't for me. There's too many pipette man wars. So I went to Wall Street and learned finance. Yeah. So I went away from pipette man wars to, I was in the heyday of before, a lot of these Me Too movements. So it was very, interesting to say. But anyway, I went to Wall Street. I worked on as an analyst, raising like over $2 billion for companies like Human Genome Sciences, doing M&A support. So I always stayed in healthcare and business. And then I was like, I want to get more experience. So I got myself a business school degree at Columbia, and then went to work in different various programs at like Sharing Plow, which is now Merck, and Pfizer for near 15 years. So I've basically been able to combine this like passion for technology, health, finance skills, in this health space.
That is incredible. So from pipettes to Wall Street to pharma, you've done it all. And I'm so curious, have, all of these different types of experiences, have they kind of shaped your career because you've had such, I would say, you're able to put on so many different lenses now based off of your experiences?
Yeah. So what's incredible is like you build a set of skill sets and
Mhm,
they carry to the next place. And one of the things for me is I'm amazing ability to learn fast.
mhm,
I think it's because I spoke, grew up speaking Japanese at home and just even learning it and not knowing it for many years. I'm used to being in an environment where I don't understand exactly, but I understand the general gist. And then that
mhm,
eventually I'll learn. So for me, basically, like I learned how to do sales. I learned how to do financial analysis. I learned how to do project management. And then I got to basically like keep pivoting. So, my last job was doing software sales for SaaS to Pfizer, selling AI software and setting up the COVID statistical, infrastructure.
mhm,
So like the skills roll over, um, and you can learn the content,
mhm,
and it's been great now because right now I've basically been asked to join the family business as a COO. The,
mhm.
the advisory board recommended that they hire an experienced COO. And so like everything I've done helps me with my network.
Right.
I have the fundamentals for skills for all these areas to look over the company, but also to
Mhm,
hire people. Like I know what good looks like for all sorts of functions. So
right.
that diversity of experiences has been amazing, but also the skills
Yeah.
is good. I have a couple solid skills to develop. So yeah.
That's awesome. I mean, number one, you're just like a full Swiss Army knife, can do it all, which I think is so incredible. And I like that you mentioned how being able to get exposure into specific areas means that you can know what to look for when you're hiring. I think that is really, really interesting and very important when it comes to, building out a team. You kind of know what to look for.
Yes.
That's
Yes.
incredible. And so speaking of, all of how all of this has led you to your current role right now, the intersection between health tech and nutrition, I think is just so interesting. So I'd love if you could tell us a little bit more about just the work that you're doing at Maypro.
Yeah. So I'm doing basically two things. Maypro is near $100 million business. It's the 45th year this year.
Oh, wow.
We started bringing in innovative ingredients.
Mhm,
We represent companies that are big companies like Asahi, Japanese companies that have great products, introducing them, marketing them to the US and around the
mhm,
globe. We also have final products using some of these great ingredients called quality of life labs, where we actually put these ingredients in products ourselves, and help people understand how they can be used.
mhm.
What I'm doing as the COO is what you call modernizing the business, bringing in new ways of doing things, and kind
Mhm.
of bringing us from, so I'm building the business, like the skills, I'm skilling
Yeah,
up everybody and then going to the next stage,
nice.
so we're doing a lot of digital marketing for, letting our manufacturers know about these new ingredients. But then the other thing I'm trying to do is get data, so people are like, what's human clinical studies? And like one of our biggest products, for example, AHCC, this product has been used for like over 20 years. It's shiitake extract. It
Mhm,
has like sold out during COVID because of its immune enhancement properties. And,
mhm.
for many years, it was used for cancer. A lot of cancers where like people are just getting these like, hey, this is helping me.
Right.
And this is before immunotherapy was a thing, right?
Mhm,
But
mhm,
nobody's going to do a multi-billion-dollar clinical trial on shiitake. Like they're just
mhm.
not, you know. So, we have a lot of human studies, but I want to use like data science to help,
Mhm.
clarify the mechanism a little bit more of nature and
Right.
help us create more pipeline of products, so we can have people, nature derived, better understanding the mechanism, so people can like live better, you know what I'm saying? So I lived in like pharma for many years, but I can't tell you how many times people want to ask me more about what supplement to take. They just
Mhm,
don't care about which drug to take. They want to know,
mhm.
how can I control my health? So
Right.
bringing more things like this to market. So those are the kind of things I want to do: modernize operations, but bring science to the sector.
That is incredible. And I love like the use of data, especially kind of for the clinical trial or like that type of research lens, knowing that it is such a huge gap. And it, like you mentioned, it's not something that a lot of, these large organizations that kind of have the capability to do it are really prioritizing. So I love that you're just, taking that under your wing of, what, if no one's going to do it, we're going to be the ones to do it, which I think is amazing. And so based off of kind of a lot of what you're talking about when it comes to modernizing, but just really integrating technology, would love if you could share some, other opportunities for data science to kind of be married with this holistic approach for, your health. How is Maypro doing that? And why is that so important to kind of have both sides of it?
Yeah. So my last job in pharma, before I was kind of, asked to join this family business, was working CAR T therapies. And I'll tell you, the moment, these cells would die on, and I don't want to tell brand names or too much, but the cells would die. You're getting people's white blood cells out, you're going to genetically modify and then put them back in, but the cells would die in transport, and this is many years ago. So a lot of that is improved. We would look through the cell samples, we would do we would do tree analysis on all the data, and you would find things that a lot of people were vitamin deficient. All right. Yeah. And I was like, wow, these patients have been through like numerous stem cell transplants, right? There are like 70 something. And these are the energetic ones showing up as clinical trials.
Yeah.
But they're just depleted. And here we're trying to throw like fancy smanchy stuff in. And then the side effects are also like, whoa, like we didn't know, right? So things like cytokine storms, like this was happening before COVID made that a name, right?
Yeah.
So data science was starting to get used because people were like, what's going on? So I love the fact that we are more aware that basic nutrition is relevant to health. I mean, with the COVID crisis, people realized that those with comorbidities and the basically preventative stuff is the foundations. You can throw a lot of great drugs on you, but you got to get the foundation. So I think for us, we're really proud, like quality of life, we have condition-based supplements, for in a lot of areas where you don't have a drug yet, but like, there's like something you should be doing, basic health. We have products for it. We provide as Maypro ingredients to a lot of these companies that are doing cutting edge science. So a company called Life Force, which has Tony Robbins, like they do blood draws so that they can do more specific understanding of like, what are you short in for, your nutritional supplementation. And then we'll have natural derived things that might help you with blood flow. Right. So if you want to be more fit, so this, will be naturally derived substance that you can, it's not a drug, like, but it can help you with your best life, in middle age, for example. Right. So there's a lot of these people right now. I do see a trend where people are combining both the RX plus the supplements to get to your best life, because you don't just go to the doctor when you're sick. You want to live that combo, watching and living, because we're going to have a nice long life now, right, guys? Like 50 is just midway, but we're going to 100, no problem, right? So how do you live it nicely? So we're providing ingredients. I love to up our game, provide the data, so people can have that nice life, best life.
Absolutely. I love that. That's amazing. That's a mission statement if I've ever heard of one. And one I fully support, living a nice, long, healthy life. And I really do think that, it's always so, like, the pandemic is very, very unfortunate and horrible. But I think it is really interesting how, having that collective experience, I think, has made us all very aware of just health in general. I definitely know that it's made me be so much more conscious about, how am I interacting with my health? What am I putting into my body? Things like that. I think it's this collective conscious that I think we've all developed, in the past 2 years. So I think it's, really timely and I think very important. I definitely want to pick your brain about all of this, the supplement stuff, because I think it's just so interesting. But before we kind of get into that and I ask all my questions, wanted to learn a little bit more about the work that you're doing kind of from a, machine learning and sales perspective, since I know that there's some work that's being done, around data segmentations to really make sure that, the products are going to the right people, the ones that can benefit from them the most. So I'd love if you could share a little bit more about what that looks like.
Right. So I worked a lot on kind of proof of concept projects supporting Pfizer, but a lot of health companies. And I'll tell you, machine learning works best when there's good data. The people who are most advanced in it is the government, banking, in fraud, and also forecasting. Right. So machine learning is basically kind of getting lots of data with computing power to see patterns. Basically, it's not that simple. So for forecasting, this product HCC just sold out, clear out, sold out. And a lot of people in our industry, their supply chain is just a mess because a lot of the ingredients do come from China, India, and then the plants, there's just such a boom for the plants, so capacity issues. So what we're doing is using, so I had the opportunities because I used to work at SAS, to do part of their hackathon and use some of their software to help do better forecasting and inventory planning, but also start doing more sensing demand, right? Because you can't be like, hey, I can make this much, I'm going to sell it. You have to say how much demand is there, therefore I should talk to the people that make it, and then can I advertise, right? Because, and how sensitive to it is it? So this highly sensitive to Google, Amazon, Facebook. So it's like a math formula, it's like optimizing. So I'm putting that discipline into Maypro for ourselves for now, for our quality of life lab subsidiary. But I do think it's something that I'd love to develop for others. And then the other part is we do a lot of work in Japan with another kind of end product, kind of beauty from within product line that we have in Japan, and more segmentation of the customer types. That's where, again, what are the patterns, right? And who are the anomalies? And so that you can, ultimately, that's what the Amazons of the world are doing, or even Chico's, like they know, like someone like you bought this, but that's patterns, right? So trying to use that because the advertising is much more effective over time. So the operational usage of AI has been for a long time very productive. So that's the kind of places I want to apply it. It's not AI, it's more machine learning.
Right. Yeah, 100%. And I can imagine kind of in your industry where there are a lot of, complex supply chain, processes, whether you're going to all of these other countries for their raw ingredients and the manufacturing, that is just very, very important. So I think it makes a lot of sense that was kind of, one of the things that you implemented.
Yeah, but I'm going to be honest, everything's about the data. And at the end of the day, people to people, it doesn't end. It's for certain areas. It makes us smarter.
For sure. Love that. Yeah. It's optimizing those human interactions a little bit. 100%. So now I want to just pick your brain about all things supplements. As someone who's personally interested, I would imagine folks in the audience will be as well. So I think that there's been, like we had mentioned earlier, there's kind of a renewed interest in more natural solutions, what have you. But I think there's also a lot of awareness and almost hesitancy when it comes to, you'll see things on social media, whether or not it's actually like clinically effective. So for kind of your perspective, what are some things that, a consumer should consider when it comes to, picking up a bottle and looking at a supplement to make sure that it has been vetted, that it's safe and effective? Are there kind of some key indicators that can help with that decision-making process?
Right. So, supplements are it's a consumer product and there's a price point for everybody. And I do think that, one of the things that we make sure when we work with our partners is that what was in the study, there's not a lot of studies, but whatever we did have with the human studies, that dose is in the supplement. Okay. There's a lot of you need to make margin, right? So there's a lot of temptation to just sprinkle, right? It's the same with skincare. You could sprinkle glycolic acid, or you could really put in glycolic acid or retinol, right? So I think there's certain brands that try to live that way. you know, with this, you know, they'll try to write in the clinical dose. They typically tend to quote the science. They tend to be adding a little bit more ways for you to find these supplements. Also, there might be questionnaires or doctors or whatever. I mean, I think those are good. Some certain brands, like we sell to some great brands like from healthcare doctor brands as well. So a lot of these brands are very careful to make sure that the product is the data is in there. I mean, I always say at the end of the day, it's a personal choice, but I'm lucky I have quality of life supplements myself. So I have a family that I have formulators in a family who will only make something that I can take and my family can take. So you can always go to Quality of Life Labs, and because that's our mantra. You know, given that I was in pharma for so many years, I said to everybody, don't make me feel embarrassed. Put, you know, do you put your best science in there?
Right.
You
100%.
Yeah, and so that's something that we've done over the years. So I think Quality of Life Labs, you can always chat with me later and I'll try to get you a family discount code. But yeah, I mean, just it's really, you know, a lot of them are fun supplements. You know, it's hard to put certain amounts in a gummy. Like it doesn't, you know, heat melts things. But there are, you know, so people work really hard to make sure that you can put in these premium ingredients. But a lot of times, just remember, like, it's not bad that it's fun. It's just that it's hard to get to a certain price point, right? So that thing is like $20. You just can't put in the right dose of anything, right? So you just gotta remember all that, right? So but you know, a multi, you don't need to spend a lot, right? Because the ingredients are bulk sales.
Right. No, that's so interesting. And I love kind of like really just having that awareness of, you know, what is the modality of this thing, like logically, you know, if can all of this like fit in a gummy, and if they're saying that it's there, like how much actually is in there. So paying attention to the dosages, I think, is really sound advice, and definitely something that I will carry on.
And the reviews are, you know, over time, the reviews gotten like less, you know, safe to look at also. But yeah, I do think you've got to just try it. Some stuff does feel better for you.
Just some trial and error. That just, I think with a lot of things, you just got to see what happens. That's amazing. We do have one question from the audience I want to make sure that we get to. So this question reads, thinking about value-based care and the emphasis on prevention, what are Maypro's opportunities and biggest barriers to overcome?
Yeah, so preventative care, I think, is not really reimbursed, you know, I mean, for like supplements. And so for us, but believe it or not, like our sector is $170 billion around the world, no reimbursement, guys. That's the same size as health tech. So people will pay to make sure they live their best life. You know, I think there's some medical channel supplements. Those do get some botanical NDAs or medical foods, but it's not big. It's not big, and nobody's ever banked on it. Because the consumer need is so big, they'll pay.
No,
right. So it's funny, like in health, I'm an advisor in a predictive genomics company with digital twins, and forget it. In the US, it's like, oh, you create, you know, 100 studies before I can reimburse you. You're like, you know what, like that's a lot of money, you know, we could have saved that much in the healthcare system, but there's just so much you can't. And then nobody's buying it anyway. There's so many other solutions. They're like, you know, it doesn't hurt them enough to pay for it. So, you know, I find that this sector is a little bit more, it's based on your needs and something that helps you. So it hasn't been so much of a barrier, fortunately.
That's good. That's definitely good to hear. Thank you for that question. We do have another question. So this participant asks that you had mentioned AI being used in governments, banks, and question mark. I think it was fraud. I think you said fraud.
Fraud.
Yep. And so the question is, what do you think the obstacles are in implementing more AI machine learning in healthcare?
Yeah, so we tend to put it on the hardest problems that humans could not solve, right? So, and that there's no data. So they're like, oh, I'm going to do AI and rare diseases. And I'm like, there's not enough patients, guys. Like you can't find pattern with like, 1,500 patients. You need data over time. And you need to collect it. So the hardest thing is collecting the data, and then it's got to be good data. It's got to be set up to solve a question.
Right.
Over time, it's kind of like a market research survey. You could have tons of them, but then you look at it later and you're like, I can't multi-analyze it, right? So you got to set it up in a way that you can look at it. So data is number one. Of course, the privacy of data is going to be more and more an issue. Everybody's trying to grab everybody's data. But then it's in silos now.
Right.
So because it's a data war. So the analytics are open source, but the data is in silos, and everybody's trying to charge everybody for it. So then in the end, we can't. So the people who are going to do well is China, the Middle East, the people who have single payers who are like, I need to solve my population genomics problem, my population health problem, and they can do it because it's not like each trying to make a buck from their data.
That's a very, very good point. And even when we think about like AI, machine learning being used for like the operational tasks within healthcare, it's still that issue of cost and of privacy. I think those are like very universal themes, especially here in the States.
Yeah.
That makes a lot of sense. Well, I see we're exactly at 10. So I just wanted to thank you so much, May, for a very engaging discussion. Definitely learned a lot about, I think, just your amazing background and the work that kind of is being done with a lot of these spaces, but also has opened my eyes up to how to be a very good consumer when it comes to nutritional supplements. So I definitely thank you for taking the time to chat with us today.
Yeah, no, thank you. Anybody who wants to do innovation, please contact me. We take interns that can work on startups together. So please contact me. Love the community. Thank you so much for inviting me.
Love that. Thanks, May. And for everyone that's interested, May, her LinkedIn information is in the chat. So please be sure to connect with her to chat further. We are very excited with our guest next week, Sophia from Pandia Health. So please be sure to check out our episode next week. We also have our symposium tomorrow. All of the registration information is in the chat. And we have been launching our podcast. So we have one of our Women's Health Tech Wednesday speakers. Her episode will be released today as well. Wanted to give one last shout out to May, as well as thank our sponsors, Goodwin and Witham, for sponsoring this conversation. And have a great day, everyone. We'll see you all next Wednesday. Bye.